So EMDR 2.0 is actually, we started with EMDR, but we are both doing a lot of intensive work and we are both working a lot with complex PTSD patients. So I didn't tell you before, but I'm the head of the Ultimate Academic Anxiety Center, which is a center for complex PTSD also, but also complex anxiety disorders and complex OCD. But what we saw a lot, of course, is that some people, they keep avoiding, they have a lot of problems with dissociation, they don't want to start, they are really afraid of starting to do the work. And then we learned a lot from our patients, but we also learned a lot from laboratory research. So EMDR 2.0 came to exist because of the two worlds coming together, the laboratory and the field. So what it is actually we try to enhance EMDR therapy by looking at the working mechanism of EMDR and then trying to make it better and faster. So if you know exactly, hey, I have to turn on this button or I have to push this button or do it a little bit like that to make it faster or more effective or more efficient. And that is what actually we try to do with EMDR. And that is
So,
how EMDR 2.0 started to exist. And it is not only, some people think it's only about doing different working memory taxation tasks. That's not the case. It's also about activating the memory if that is necessary. So EMDR 2.0 is more like a toolbox, and you as a clinician have to decide, oh, this is today the tool I need to use. So you don't have to use always all the tools that are in EMDR 2.0. EMDR 2.0 is about motivation, activation, and desensitization, but it also has different techniques to help somebody to get into the memory or to help somebody to overcome the fear to do the therapy.
and if you look uh, on how you apply EMDR and you consider its the working mechanism is largely depend on working memory taxation, then you see a lot of challenges in which you enhance EMDR, and that's what we started to do in our clinics. So the most difficult patient, highly dissociative patients, we after a while we could treat them by putting a large amount of working memory taxation on these memories, and and we learned so much that we placed that in our model. So from the working memory theory, you can predict some things like the memory needs to be activated. There's a lot of research supporting that. Memory needs to be to the maximum. And if you do that, putting in triggers from that triggers the memory and enhance the arousal. If you do that, and at the same time you place a lot of working memory taxation on it, and we developed a lot many techniques to do that in different ways, not only eye movements or fast eye movements, but all other types of techniques that are helpful. So I think that if you do this training, you will learn a lot how to enhance your work and enhance the effects. So nowadays it's possible in EMDR 2.0 to do 3, 4, or 5 memories in, and with a good result.